Welcome to our channel. Today we're diving into an important topic that affects millions of people worldwide: diabetes. It's a condition that impacts how your body uses glucose, its primary source of energy. We'll explore the different types of diabetes, their symptoms, and some essential management tips. Whether you're newly diagnosed, have loved ones with diabetes, or simply want to learn more, this video is for you. Let's get started. Type 1 diabetes, often diagnosed in childhood or adolescence, is an autoimmune disease. It means your immune system mistakenly attacks the insulin-producing cells in your pancreas. Without insulin, glucose builds up in your bloodstream, leading to various health problems. Symptoms of type 1 diabetes often appear quickly and can be quite noticeable. You might experience excessive thirst, frequent urination, unexplained weight loss, increased hunger, fatigue, and blurred vision. Managing type 1 diabetes requires lifelong insulin therapy, either through injections or an insulin pump. A balanced diet, regular exercise, and monitoring your blood sugar levels are essential for keeping your glucose levels in check. Living with type 1 diabetes can be challenging, but it's manageable with the right knowledge and support. Remember, you're not alone in this journey. Type 2 diabetes is the most common form of diabetes, often developing in adulthood. Unlike type 1, where the immune system attacks insulin-producing cells, type 2 diabetes is characterized by insulin resistance. In type 2 diabetes, the cells become resistant to insulin's effects, like the key doesn't quite fit the lock anymore. This resistance forces your pancreas to work harder, producing more insulin to compensate. Over time, the pancreas may not keep up, and blood sugar levels rise, leading to type 2 diabetes. Several factors increase your risk of developing type 2 diabetes, including family history, obesity, physical inactivity, and age. Adopting a healthy diet rich in fruits, vegetables, and whole grains, while limiting processed foods, sugary drinks, and unhealthy fats, is essential. Regular physical activity is equally crucial, aiming for at least 150 minutes of moderate-intensity exercise each week. By making healthy choices, you can effectively manage your condition and live a long, fulfilling life. Gestational diabetes develops during pregnancy, usually in the second or third trimester. It occurs when the body becomes less sensitive to insulin, the hormone regulating blood sugar levels. Symptoms may include increased thirst, frequent urination, or fatigue. Managing it involves monitoring blood sugar, a healthy diet, and regular physical activity. Medication may be necessary to control blood sugar levels. Post-delivery, continue monitoring blood sugar to reduce the risk of type 2 diabetes. Think of prediabetes as a yellow light on your health dashboard, a warning sign that your blood sugar levels are higher than normal, but not high enough to be diagnosed with type 2 diabetes. Ignoring this warning sign could lead you down a path toward developing full-blown diabetes and its associated complications. The tricky thing about prediabetes is that it often doesn't present noticeable symptoms. That's why getting regular checkups and blood sugar screenings is crucial, especially if you have risk factors like obesity, family history of diabetes, or a sedentary lifestyle. One of the most effective ways to reverse prediabetes is through weight management. Losing even a small amount of weight, say 5 to 7% of your body weight, can significantly impact your blood sugar control. Regular physical activity plays a vital role. Aim for at least 150 minutes of moderate-intensity exercise per week. Focus on consuming plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Frequent urination, medically known as polyuria, is a common symptom of diabetes. When there's not enough insulin or your cells become resistant to it, glucose builds up in the bloodstream, creating a traffic jam. To relieve this congestion, your body tries to flush out the excess glucose through urine. As glucose gets filtered into your urine, it pulls water along with it, leading to increased urine production and the urge to urinate more frequently, especially at night. This can disrupt your sleep and leave you feeling exhausted. If you're experiencing frequent urination, especially at night, it's essential to talk to your doctor. They can assess your symptoms, check your blood sugar levels, and determine the underlying cause. Increased thirst, medically known as polydipsia, is another common symptom of diabetes, often accompanying frequent urination. When glucose builds up in your bloodstream due to insulin resistance or deficiency, it throws off the balance of fluids in your body. Your body tries to dilute the high concentration of glucose in your blood by drawing water from your tissues. This process leads to dehydration, triggering your thirst mechanism to signal the need for fluids. As you drink more fluids to quench your thirst, it further contributes to frequent urination, creating a vicious cycle. If you're experiencing excessive thirst that seems out of the ordinary, it's crucial to pay attention to your body's signals. It's essential to consult with your doctor to determine the cause of your increased thirst and receive appropriate treatment. Unexplained weight loss might seem like a welcome surprise for some, but it can be a concerning symptom, especially when associated with diabetes. In diabetes, the body's ability to utilize glucose for energy is impaired. Without sufficient insulin or with insulin resistance, glucose can't enter the cells efficiently, leading to an energy deficit. To compensate for this energy shortage, your body turns to alternative fuel sources, stored fat and muscle. As your body breaks down fat and muscle for energy, it leads to weight loss even without intentional dietary changes or increased physical activity. If you're experiencing sudden and unintentional weight loss, it's crucial to consult with your doctor to rule out any underlying medical conditions, including diabetes. Feeling constantly tired and drained? Fatigue is a common symptom of diabetes, often leaving individuals feeling sluggish and lacking the energy to perform daily tasks. In diabetes, the body struggles to utilize glucose effectively. This inefficient glucose utilization leads to an energy deficit at the cellular level, manifesting as fatigue. Moreover, the constant fluctuations in blood sugar levels associated with diabetes can also contribute to fatigue. When blood sugar levels spike and crash, it disrupts the body's natural energy balance, leading to feelings of tiredness and exhaustion. If you're experiencing persistent fatigue that interferes with your daily life, it's essential to talk to your doctor. They can assess your symptoms, check your blood sugar levels, and determine the underlying cause of your fatigue. Blurred vision is a common symptom of diabetes that can significantly impact your daily life. High blood sugar levels can disrupt the fluid balance in your eyes. When blood sugar levels are elevated, it can cause the lens to swell, affecting its ability to focus light properly. This swelling leads to blurred vision, making it difficult to see clearly. Over time, uncontrolled high blood sugar can damage the tiny blood vessels that nourish the retina, a condition called diabetic retinopathy. This damage can lead to vision loss and even blindness if left untreated. If you're experiencing any changes in your vision, including blurred vision, double vision, or floaters, it's crucial to see an eye doctor immediately. Have you noticed cuts, scrapes, or sores taking longer to heal than usual? Slow wound healing is a common complication of diabetes, often indicating underlying issues with blood sugar control. High blood sugar levels can damage blood vessels, impairing blood flow and slowing down the healing process. Moreover, high blood sugar creates a favorable environment for bacteria to thrive, increasing the risk of infection in wounds. Infections further complicate the healing process, leading to delayed healing and potential complications. If you're experiencing slow wound healing, it's essential to pay close attention to your blood sugar control. Follow your doctor's recommendations for managing your diabetes through medication, diet, and exercise. If you notice any signs of infection, contact your doctor immediately.